Did you know pancreatic cancer could be warning you months before it's too late? Did you know that pancreatic cancer claims the lives of more older adults every year than colon cancer? Yet millions of people over the age of 60 have never been told about its earliest warning signs. What makes this disease especially dangerous is that its symptoms often appear months before the cancer becomes untreatable. Months right now, countless people are sitting in their living rooms believing they simply need more sleep, assuming their aching back is just another sign of aging, or blaming an upset stomach on something they ate. But what if those seemingly harmless symptoms are actually your body trying to warn you? There's a good chance you've already experienced at least one of the 8 warning signs we're about to discuss and dismissed it as something completely unrelated. I'm Doctor, and over the next few minutes, I'm going to share information that many seniors never hear during a routine doctor's visit. Here's the truth that isn't talked about often enough. Pancreatic cancer doesn't have such a low survival rate because it's impossible to treat. It has a poor survival rate because it's usually discovered far too late. By the time it's diagnosed, the disease has often spread beyond the pancreas, making treatment much more difficult. That's why it's so important to watch this video until the very end. We'll go through 8 early warning signs that could appear while the cancer is still potentially treatable, and pay especially close attention to symptom number 5. It's one of the most overlooked warning signs, yet it may be among the most important. Surprisingly, many patients are never told about it, even though it deserves far more attention. Everything we discuss today leads up to that symptom. Before we begin, however, there's something you need to understand about why pancreatic cancer is particularly dangerous for older adults. Unlike many other organs, the pancreas is hidden deep inside your abdomen. You can't feel it from the outside, and during a routine physical exam, your doctor usually can't examine it directly. Even standard annual blood tests often fail to detect pancreatic cancer until it has already reached an advanced stage. This isn't because doctors are careless or because medicine has failed. It's because pancreatic cancer is incredibly good at hiding. Instead of causing obvious warning signs, it disguises itself as the same aches, pains, and digestive changes that many people naturally associate with getting older. That is exactly why recognizing the subtle signals early can make such a significant difference. Let's begin with the first warning sign. Symptom #1, dark urine, that doesn't have an obvious cause. When many seniors notice that their urine has become darker than usual, they immediately assume they're dehydrated, so they drink more water. For a day or two, the urine may appear lighter, and they convince themselves the problem has been solved. Unfortunately, that assumption can sometimes delay the diagnosis of a much more serious conditions. Here's what's actually happening inside the body. Your pancreas sits very close to a small tube known as the bile duct. This duct carries a yellow pigment called bilirubin from your liver into your intestines. Bilirubin is responsible for giving stool its normal brown color, while also contributing to the normal yellow color of urine. If a tumor develops in the head of the pancreas, the section closest to the bile duct, it can begin pressing against this narrow passageway. As the tumor grows, it partially or completely blocks the flow of bile. When bile can no longer travel into the intestines as it should, bilirubin starts building up inside the bloodstream. Your kidneys then work to remove this excess bilirubin from your blood, causing your urine to become much darker than normal. Instead of its usual pale yellow color, it may appear dark amber, deep brown, or even resemble strong tea or cola. And here's the important detail that separates this from ordinary dehydration. With dehydration, increasing your water intake usually keeps the urine lighter. But when elevated bilirubin is the cause, the dark color often returns again and again, no matter how much water you drink. That recurring change should never be ignored, especially if it's accompanied by other unexplained symptoms. The symptom #2, persistent dark urine, that keeps returning you drink more water. The color improves for a short time, then the very next day, your urine is dark again. Why? Because the underlying problem hasn't gone away. If a tumor is blocking the bile duct, drinking water cannot remove that blockage. It may temporarily dilute your urine, but it won't stop bilirubin from continuing to build up in your bloodstream. That's why the dark color keeps coming back. For many people with pancreatic cancer, this is one of the earliest visible warning signs. Unfortunately, most seniors dismiss it several times before mentioning it to healthcare providers. They assume they're dehydrated, they think they haven't had enough fluids, or they blame it on a vitamin supplement or medication. Meanwhile, the disease continues to progress quietly. If you've noticed your urine repeatedly changing between normal and unusually dark for more than 2 weeks, despite staying well hydrated, that isn't something to ignore. It deserves medical attention. Schedule an appointment with your doctor as soon as possible and explain exactly what you've been experiencing. Sometimes acting early can make a critical difference. Now that you understand what recurring dark urine may be telling you, let's move on to another warning sign, one that is often mistaken for something far less serious. Symptom #3, pain in the upper abdomen that spreads to the back. This is one of the most commonly misunderstood symptoms of pancreatic cancer. Many people are told it's arthritis, others are told it's a pulled muscle, chronic back pain, acid reflux, or simply another part of getting older. Those explanations may be correct in many cases. They can also delay the diagnosis of pancreatic cancer when the real cause is overlooked. At first, it may seem mild, but it rarely stays in one place. Instead, it gradually spreads through the body, wrapping around the torso before settling deep in the middle of the back. Many patients describe it as feeling like a tight band squeezing around their body. Why does this happen? Because the pancreas sits next to a dense network of nerves. As a tumor grows, it can press against these nerves or invade nearby tissues, causing pain that radiates far beyond the pancreas itself. There are three important features that help distinguish this pain from ordinary back problems. First, the discomfort often becomes noticeably worse after eating. Typically, the pain increases within 30 to 60 minutes following a meal as the pancreas becomes more active during digestion. Second, lying flat on your back frequently makes the pain more intense. Many people unknowingly begin sleeping in a recliner or propping themselves up with several pillows simply because they feel more comfortable sitting upright. Third, the pain tends to resist the usual treatments. You may take pain relievers, you may apply heat, you may rest for hours, yet the discomfort keeps returning in the same pattern because the source of the pain hasn't been addressed. Symptom #4, feeling full after just a few bites. Imagine sitting down for dinner, you take only a few bites, and suddenly you feel completely full. So you push your plate away and tell yourself, I guess my appetite just isn't what it used to be. Many older adults assume this is simply another part of aging. But in some cases, it may be something far more serious. As a pancreatic tumor grows, it doesn't stay confined to the pancreas. It begins pressing against nearby organs. And one of the closest is your stomach. When the tumor pushes against the stomach from behind, it physically reduces the amount of space available for food. As a result, your stomach feels full much sooner than it should. At the same time, the pancreas may stop producing enough digestive enzymes, the substances your body needs to break down food properly. Without enough of these enzymes, food remains in the stomach longer than normal. Digestion slows down. Your stomach stays full, and your brain receives signals telling you that you don't need to eat, even though your body desperately needs nourishment. Whether in the stomach for hit without the stomach, or the tumor pushes against the stomach from behind, it physically reduces the amount of space available for food it reaches a more advanced stage. Before we continue, there's something important I want you to keep in mind. Over the years, one particular symptom has appeared again and again in people whose pancreatic cancer was diagnosed at a late stage. Nearly every one of them noticed it. Nearly every one of them ignored it. We'll reveal that warning sign before the end of this video. But first, let's look at another symptom that is often visible long before many people realize what's happening. Symptom #5, yellowing of the skin and eyes. It begins to collect in body tissues. The result is a yellow discoloration of the skin, and most noticeably the whites of the eyes. For people with darker skin tones, jaundice may be easier to recognize in the eyes, the palms of the hands, or the inside of the mouth rather than on the skin itself. Unlike a temporary skin discoloration, jaundice is never considered a normal part of aging. It is a medical warning sign that requires prompt evaluation, especially when it appears alongside symptoms such as dark urine, pale stools, unexplained weight loss, abdominal pain, or loss of appetite. The earlier the underlying cause is identified, the greater the chance of receiving effective treatment. Jaundice is often recognized by yellowing of the skin or the whites of the eyes. But there is another part of this symptom that many people are never warned about: intense itching. This itching may occur all over the body. There may be no rash, no visible irritation, and little or no relief from lotions or antihistamines. Why does it happen? When bilirubin builds up in the bloodstream and begins depositing in the skin, it can irritate nerve endings directly. The itching can become persistent, frustrating, and difficult to ignore. What makes jaundice especially challenging in older adults is that it can resemble jaundice caused by gallstones. Both conditions may cause yellowing of the skin or eyes, generalized itching. Because gallstones are relatively common in people over 60, the initial assumption may be that gallstones are responsible. In some cases, that assumption can delay a more complete evaluation. That is why it is important not to focus on just one symptom by itself. If yellowing of the eyes or skin appears together with dark urine, upper abdominal pain that spreads to the back, feeling full after only a few bites, or unexplained weight loss, the overall pattern becomes much more important. Make sure your doctor hears the complete picture, not just one isolated symptom. Symptom, #6, changes in stool. Another warning sign that is often overlooked is a noticeable change in stool. If stool becomes bile cannot reach the intestines properly because of a blockage. Stool may become much lighter than usual. Instead of its normal brown color, it may appear pale, clay-colored, grayish, or unusually light. Some people also notice that the stool becomes greasy, oily, difficult to flush, or floats in the toilet. When this happens because the pancreas helps produce enzymes needed to digest fats. If those enzymes are reduced, fat may pass through the digestive system without being absorbed properly. Because of a blockage, stool may become much lighter than usual. Instead of its normal brown color, it may appear pale, clay-colored, grayish, or unusually light. This next warning sign is less well known, but it can be very important. In some people, pancreatic cancer can affect the way the blood clots. The body may become more prone to forming clots, sometimes before the cancer has been diagnosed. One common location is the deep veins of the legs, a condition known as deep vein thrombosis. Possible signs of a clot in the leg include swelling, in one leg warmth in the affected area, aching, heaviness, or persistent pain in the calf or thigh. Symptoms that do not improve with rest or elevation. This becomes especially serious if part of the clot travels to the lungs, causing a pulmonary embolism. Seek emergency medical help immediately if you experience sudden shortness of breath, sharp chest pain, especially when breathing in, a rapid heartbeat that starts unexpectedly, fainting or feeling faint. These symptoms require urgent emergency care. Research has shown that in some pancreatic cancer patients, an unexplained blood clot was one of the earliest warning signs, sometimes appearing months before the cancer was discovered. That does not mean every blood clot is caused by cancer. Many blood clots have other causes, but when a clot appears without a clear explanation, especially alongside other symptoms we have discussed, it is worth mentioning to a doctor. Symptom #8, persistent fatigue and weakness. The final symptom is often the easiest to dismiss because it sounds so common, fatigue, but this is not ordinary tiredness after a busy day. People often describe it as a deep, persistent exhaustion that does not improve with sleep, rest, or taking it easy for a few days. You may wake up tired. Simple tasks may feel unusually difficult. Walking across the room, climbing stairs, cooking a meal, or carrying groceries may require much more effort than usual. This can happen because the body is under stress from inflammation, poor nutrition, reduced digestion, weight loss, and the energy demands of the illness itself. By itself, fatigue is very common and usually has many possible causes. But when fatigue appears together with unexplained weight loss, loss of appetite, digestive changes, dark urine, jaundice, abdominal or back pain, or an unexplained blood clot, it should not simply be dismissed as aging. One of the lesser-known warning signs of pancreatic cancer involves changes in blood sugar. For some people, the pancreas begins to lose its ability to produce insulin properly before the cancer is ever diagnosed. As a result, someone who has never had diabetes may suddenly develop high blood sugar later in life, particularly after the age of 50. Others who already have diabetes may notice that their blood sugar becomes much harder to control, even though they haven't changed their diet, medication, or daily routine. This doesn't automatically mean pancreatic cancer is present. Type 2 diabetes is very common, especially in older adults, and there are many possible causes. However, when new onset diabetes appears alongside unexplained weight loss, persistent abdominal pain, jaundice, or other warning signs we've discussed, it deserves careful medical evaluation. If you've recently been diagnosed with diabetes without an obvious reason, or your blood sugar has become unexpectedly difficult to manage, discuss it with your healthcare provider. Looking at the full picture, not just one symptom, can make a meaningful difference. Another sign that shouldn't be ignored, recurrent low-grade fever. Some people with pancreatic cancer experience episodes of low-grade fever that seem to come and go without a clear explanation. You might feel chilled even in a warm room. You may begin shivering unexpectedly. A mild fever develops, then fades away, only to return days later. This can happen because cancer and blocked bile ducts may trigger ongoing inflammation or increase the risk of infection. Unlike a typical viral illness, these symptoms may persist or repeatedly return instead of resolving completely. If you've had recurring fevers for several weeks and no clear cause has been identified, especially when accompanied by other symptoms such as jaundice, abdominal pain, or unexplained weight loss, it's important to let your doctor know. Persistent or recurring fever deserves evaluation rather than simply assuming it's just another bug. Persistent fatigue that doesn't improve. We've all experienced ordinary tiredness. After a busy day or a poor night's sleep, feeling exhausted is completely normal. Usually rest helps, but the fatigue associated with serious illness is different. It doesn't disappear after a full night's sleep. You may sleep 8 or 9 hours and still wake up feeling completely drained. Even simple daily activities may leave you feeling unusually weak. This can happen because your body is dealing with ongoing inflammation, poor digestion, reduced nutrition, weight loss, and the increased energy demands of illness. Result is a level of exhaustion that feels out of proportion to your daily activities. For the occasionally, its fatigue alone is very common and usually has many non-serious causes. Persistent fatigue that occurs alongside several of the warning signs we've discussed should not be ignored. Pancreatic cancer is challenging to detect because its earliest symptoms often resemble common health problems or normal aging. That is why recognizing patterns is far more important than focusing on any single symptom. Dark urine, upper abdominal pain that spreads to the back. Feeling full after only a few bites. Unexplained weight loss. Jaundice. Changes in stool. Unexpected blood clots. Persistent fatigue. New onset diabetes. Recurring low-grade fever. Each of these symptoms can have many possible causes, and most people who experience one of them do not have pancreatic cancer. However, if several of these signs appear together or continue without a clear explanation, don't ignore them. Schedule an appointment with your healthcare provider and describe all of your symptoms, not just the one that bothers you the most. Early evaluation doesn't guarantee a diagnosis of cancer, but it gives your medical team the best opportunity to identify the real cause and begin appropriate treatment if needed. Listen to your body, make attention to changes that persist, and remember, when it comes to pancreatic cancer, recognizing the warning signs early can make a significant difference. Persistent fatigue that doesn't improve with rest and/or one feels tired from time to time. A busy day, poor sleep, stress, or illness can leave you exhausted. But in most cases, rest helps you recover. The fatigue associated with pancreatic cancer is different. Great to give thought. You might spend an afternoon relaxing, only to stand up feeling just as exhausted as before. Activities that once seemed effortless, walking to the mailbox, carrying groceries, climbing a single flight of stairs, or doing light household chores, may suddenly feel far more difficult than they should. Why does this happen? Cancer places tremendous demands on the body. In addition, reduced appetite, poor digestion, weight loss, inflammation, and nutritional deficiencies can all contribute to profound fatigue. Result is a type of exhaustion that many people describe as deeper and more persistent than ordinary tiredness. If you've been experiencing unusual fatigue for several weeks, especially when it occurs alongside other symptoms we've discussed, don't simply assume it's part of aging. It deserves medical evaluation. Changes in stool and digestion. The final warning sign is one many people feel uncomfortable talking about, but it can provide valuable clues. The pancreas produces enzymes that help digest fats in the food you eat. If a tumor blocks the pancreatic duct or interferes with enzyme production, fat may not be digested properly. As a result, your stool may begin to change in noticeable ways. You might observe that it becomes pale, gray, or clay-colored instead of its usual brown. Appears greasy or oily, floats more often than usual, has a stronger or unusually unpleasant odor. These changes occur because undigested fat passes through the digestive tract rather than being absorbed. Many people also experience nausea after eating rich or fatty meals, abdominal bloating, discomfort after meals, or occasional vomiting. Over time, poor absorption of nutrients can contribute to weight loss, vitamin deficiencies, weakness, and worsening fatigue. Digestive changes can occur for many different reasons, and they do not automatically indicate pancreatic cancer. However, if pale, greasy, or floating stools continue for more than a couple of weeks, especially when combined with symptoms such as jaundice, abdominal pain, unexplained weight loss, or loss of appetite, you should arrange an appointment with your healthcare provider. What should you do next? We've covered several warning signs that may appear before pancreatic cancer is diagnosed. It's important to remember that none of these symptoms by themselves prove that someone has pancreatic cancer. Many common conditions can cause similar problems. What matters is when several of these symptoms appear together, continue over time, or have no clear explanation. If, while watching this video, you recognize 2 or more of these warning signs in yourself or someone close to you, don't ignore them. Make an appointment with your healthcare provider as soon as possible. Describe all of your symptoms, not just the one that concerns you the most. Your doctor may determine that everything is related to a much less serious condition. But if further testing is needed, recognizing the warning signs early can provide more opportunities for diagnosis and treatment. Listening to your body is one of the most important steps you can take to protect your health. If you found this information helpful, consider sharing it with a family member or friend. Someone you care about could recognize a symptom they hadn't realized was important, and that conversation might encourage them to seek medical advice sooner. If you'd like to see more evidence-based health information for older adults, don't forget to subscribe so you won't miss future videos.